Okay, I'm performing hand hygiene. Hi, my name is Lori. I'm going to be your nurse today, Miss Bowie.
Yes.
All right. Is it okay if I call you Judy?
Yes.
Okay. All right. Great. I'm going to be doing a full head-to-toe assessment. It'll take probably about 30 minutes. Is there anyone that you'd like to leave the room?
No, ma'am.
All right. Can you tell me your name and date of birth?
Judy Bowie, 5/30/1950.
Okay. Can you tell me where you are?
Home,
All right. And can you tell me today's date?
February 26, 2017.
Good. Okay. So the patient's vital signs are 128/74. The heart rate is 82, regular rate and rhythm, S1 and S2 present, no S3 or S4. Respiratory rate is 16 breaths per minute. Temperature is 98.2 orally. Are these close to your normal ranges?
Yes, ma'am.
Okay, I'm going to just feel your arms and your hands. The skin is pink, warm and dry, no lesions. Do you have any tattoos?
No.
Okay. No lumps or lesions bilaterally. Nail beds are clean and translucent and trimmed. Cup refill is less than 3 seconds bilaterally. Okay. I'm going to touch your head. Okay. The skull is round, symmetrical, normal cephalic. The scalp is pink and dry with no flakes, lumps, or lesions. Do you have any tenderness?
No.
Good. The hair is clean, brown, and evenly distributed. It's fine and straight with no parasites. Face is symmetrical. Her nose is midline, no lesions. Color is pink and uniform. I'm going to check the cranial nerve 5, it's a trigeminal nerve. So I'll have you close your eyes. I'm going to touch your face just lightly with my finger.
Yes.
Feel this?
Yes.
Okay, is it equal?
Yes.
Okay, I'm going to feel your masseter and temporal muscles. Clench your teeth for me. Good. Again. Contraction is strong and equal bilaterally. Okay, so I'm going to check cranial nerve 7. Now that's the facial nerve. I need you to smile for me. Good. And frown. Lift your eyebrows. Okay. All right. It's equal bilaterally. No facial drooping. Close your eyes for me. Okay. Open. I'm going to try to close again. Good. Patient's able to resist against me trying to open her eyes. All right. The assessment of the eyes. The eyelashes are everted. They're present, evenly distributed over the upper and lower eyelids. Eyebrows are present and symmetrical. The color is brown, no scaliness or lesions. So I'm going to check your cranial nerve 2. It's the optic nerve. Place one hand over one eye. Can you read this first line for me?
AEIOU.
Okay. And the other? Do the next line.
QRSTUV.
Okay, all right, so the optic, she was able to read at 20 feet away. Now I'm going to check cranial nerves 3, 4, and 6, the oculomotor and the trochlear abducens, respectively. Can you follow my finger? Good. This way. Okay, let me get my pen light. Patient has no nystagmus and she was able to track my finger. Don't look directly at the light, but I must shine in your eyes. Good. Pupils are equal, round, reactive to light. The eyes are green. Conjunctiva is clear. The mucosa is pink and moist. Okay. All right, now I'm going to feel your ears. Ears are symmetrical. Uniform in color. She does have piercings in the lower lobes. They're warm and without any lesions. They're elastic with immediate recoil. Are they tender at all?
No, ma'am.
Here?
No, ma'am.
Not tender over the auricle or tragus. I'm going to use my light again. I'm going to look inside your ear canal. Okay? You're good. Ear canal is clean. Small amount of cerumen is present. All right. So I'm going to have you put your finger over one ear to occlude one ear.
Okay.
Okay, so I'm going to check your cranial nerve 8. It's the acoustic nerve.
Okay.
Repeat the word that you hear me say.
Puppy.
Okay, let's try the other side.
Kitten.
Okay. All right. The patient's nose is midline and without deviation. Do you have any tenderness?
No.
Okay. frontal and maxillary sinuses are without tenderness. I'm going to have you close your eyes and occlude one side of your nostril in and out. Okay, and actually, yeah, okay. Now tell me what smell.
Coffee
Okay.
beans.
All right, on the other side.
Coffee beans.
Okay, does it smell the same on both sides?
Yes.
Okay, so that's cranial nerve 1 is intact. The patient's nares are patent bilaterally. All right. Patient's lips, let me get my light again. They're pink and symmetrical. They're moist without cracking or lesions. Open for me. Okay. The mucosa is pink, moist, and smooth without lesions. The teeth are all present and white. Gingiva is pink and without edema. Okay, you can close your mouth. Open for me again. I'm going to get a tongue blade. Okay, say ah for me. Okay, right now I'm checking the cranial nerve 9. That's the glossopharyngeal. Then the uvula is soft. The soft palate rises. I'm going to do it again. Check your gag reflex. Okay. All right. That's the cranial nerve 10. That's the vagus nerve, and it is intact. The voice is smooth and not strained. Okay, can you stick your tongue out for me? Okay, good. The patient's tongue protrudes midline. The forward thrust is midline. That's cranial nerve 12, the hypoglossal. I want you to repeat these words: light, tight, and dynamite.
Light, tight, dynamite.
The lingual speech is clear and distinct. Okay? All right, I'm going to set this down. I'm going to check your neck. All right. Skin is pink and continuous with that of the face. No scars or lesions. Any tenderness?
No.
All right. Can you turn your head side to side? Okay. Full range of motion. Can you look up and down? Good. Extension, hyperextension, inflection, and lateral bending. Okay. Trapezius and sternocleidomastoid is bilateral, as equal bilaterally. Can you raise your shoulders? Good. And then down. And do it again. Okay. Got equal resistance bilaterally. I'm going to feel your lymph nodes. Okay. Good. No lymphadenopathy. Any pain or tenderness?
No, ma'am.
Okay. Let me get my stethoscope. First, I'm just going to palpate. Okay. Carotid pulses are equal bilaterally. Going to listen. Hold your breath for me. Okay. No bruise are present, which bruise would indicate that we would need further assessment with imaging or ultrasound. I'm going to listen to your lungs. Take a deep breath in and out. Okay. And again. Listen on your back. Okay. And again. Again. Good. Deep breath. One more. Okay. All right. Chest expansion is equal bilaterally, and all lung lobes are clear, and no adventitious sounds. Okay. I'm going to talk through the breast exam. I would palpate in a circular motion with the patient's arm above their head, palpate in a circular motion to feel for any lumps or lesions. There are none. Okay. And I'll do that good on both sides. There's no nodes are palpable, no masses, any tenderness, and no nipple discharge. I'll have you put your hands on your hips. Good. And then lean forward. Okay. And sit up. Arms above your head. Okay. Good deal. And there's no dimpling, no retractions that would indicate masses or tumors. All right. And this completes our health assessment. Thank you, Ms. Bailey.
Thank
Do you have any
you.
questions?
No, ma'am.
All right. Thank you for your time.